Dr. Dhivya, consultant obstetrician and gynecologist in Kauvery Hospital, Electronic City. Today we are here to discuss regarding myths and misconceptions around cesarean section. So pregnancy is the most cherishing event in a woman's life, but the pregnancy and delivery expose a woman to risk, whether it is a low risk or a high risk. So according to World Health Organization, every hour 5 women die in India because of the birthing. And this birthing can be either vaginal or a C-section. Vaginal delivery is a natural birth process, and a cesarean section is a major surgery where we cut through your abdominal wall and uterus to deliver the baby. It is one of the most challenging part a woman faces in her life. Usually, the mode of delivery is decided based on the health of the mother, health of the baby, and associated condition around the mother and the baby. Usually, C-section is decided by the doctor depending upon the maternal medical condition, heart rate of the baby. We usually do an heartbeat tracing of the baby when the baby is in the womb. If there is any problem in that heart rate tracing, we would recommend cesarean section. And if there is any placental issues or if there is an abnormal position of the baby, we recommend cesarean section. And nowadays, most of the time women, because of this modern era, the women decides and demands for C-section, thinking that it is less painful and it is on time and it takes less duration. But most of the information what we have around pregnancy and delivery, it's like half-baked information where people get it from the internet. So we are here to debunk the myths and misconception around C-section. So first thing is that people think that it is an easy way out compared to a vaginal delivery. No, that is not very true. Cesarean section, usually it's a major surgery which has its own complications. Usually a woman who undergoes a cesarean section are more prone for infection, they are more prone for organ injuries, and there can be an injury to the mother as well as to the baby. So basically you are undergoing a major surgery and it is not very simple. Even because of the anesthesia, you may have a lot of complications. The second thing is that woman thinks that she will not be aware of anything while undergoing a cesarean section. Basically they are speaking about the pain. So under anesthesia, when you are undergoing a cesarean section, you might not feel the pain, but still you may feel the tugging, traction and the stretches you will be feeling. And once the anesthesia effect wears off, might be in 12 to 14 hours, you will obviously have this pain. And this pain may persist even for 3 to 4 days, which would be bearable, but still the pain would be there. And the third thing is that whenever you have a surgery under spinal anesthesia, people usually blame the back pain, which might be because of spinal anesthesia over a long term. The spinal needle which we use is very thin, and the injury caused by the spinal needle is very minimal, and you would recover from that in 2-3 days post the surgery. So most commonly the women have this back pain and other things because of the bad posture she has, and because of lack of exercise, and because of vitamin D and calcium deficiency. The fourth thing is that people say that doctors recommend cesarean section in order to get money. This is it is not very true. We usually recommend cesarean section only because if the mother's health condition or baby's health condition is under problem. We don't recommend, and we are not provided with any incentives for doing a cesarean section. We are actually afraid of cesarean section because though it is done most commonly, there are a lot of complication, lot of stress included in this surgery. And the fourth thing is that the recovery period and the duration of mobility is long after a cesarean section. Yes, obviously from vaginal delivery the recovery period is easy and you will come back to your normal duties, take down your normal duties in 1 or 2 days. Whereas in cesarean section, we don't usually immobilize the women more than 24 hours. We usually want that woman to get mobilized, ambulate and do their routine works post 24 hours of the cesarean section, because there are lot many complications happen if the woman is confined to the bed. But recovery, as I said earlier, it will take some time. But the woman will be able to do the regular activities, routine work. She will be able to take care of herself and the baby. But the healing period will take some time. It takes around 4 to 6 weeks for the woman. Post that, she can be normal. She can start her exercise. And the other thing is that when the women deliver by cesarean section, they tell that it is they cannot initiate breastfeeding immediately. It is not so. Whatever the way the baby exists, whether vaginally or through your abdomen, the woman can initiate breastfeeding. It is totally dependent upon the mother, whether she has strength to feed the baby, she has a mindset to feed the baby, either bottle feeding or breastfeeding. She should set her mind to do anything. But you would require some help from our side if you have underwent a cesarean section to feed the baby. The proper positioning and all those things are very important when you feed the baby, but immediately you can initiate the feeding. And because of cesarean section, you need not delay the breastfeeding. And the other thing is that skin to skin contact of the baby. Usually the skin to skin contact between the mother and baby increases the bonding. Many people are afraid that if you cesarean section, you might not be able to bond with the baby. So usually you will be able to bond with the baby immediately after cesarean section also. If your baby is fine and you don't have any problem, we can initiate skin to skin contact immediately after the C-section also. Only thing is that when you hug your baby, you may have some discomfort. You should avoid the area where the tummy is cut. So if you avoid that, you might not have any discomfort in having a skin to skin contact with the baby. And the other thing is that once you had a cesarean section, people assume that they have to undergo repeat cesarean section on, whenever you get pregnant again. So usually we do allow vaginal birth after cesarean section. This is normal delivery which is happening after cesarean section. So provided there are few criteria which should be you should accomplish before opting for a vaginal delivery. One thing is that the reason for your previous cesarean section. What is the indication for the cesarean section, who has done and where it has been done, whether your health condition now and your baby's health condition allow you for the vaginal delivery. So discuss with your healthcare providers. So whatever the doubts you have regarding your cesarean section and your vaginal birth delivery, there is 1% chance that your previous scar can give away or your uterus can rupture when you undergo this. But when your criteria are fulfilled, most of them can have a vaginal delivery. And the other thing is that people think that post your cesarean section, the bleeding, vaginal bleeding will be very less. Whether you deliver vaginally or through cesarean section, you will have vaginal bleeding. The vaginal bleeding is not because of the process of your delivery. It is because once the placenta is separated from your uterus, because of the healing of the uterus and recovering your uterus back to its normal position, you might bleed. And this can extend on and off up to 45 days post your delivery, whichever way you deliver. And the other thing is that postpartum depression and blues. People think that the postpartum depression and blues are very common with vaginal delivery and it's less common with the cesarean section. It is not so. Usually the depression and the blues are because of the hormonal impact on the mother. The mother who has just recently delivered, she has to get used to the baby's demands and everything, and she has to overcome the difficulties and the pain from cesarean section, and she has to take care of herself and the baby, which is more of lot of discomfort she might have to get accustomed to it. So if she has any depression, sadness, if she has thoughts to hurt herself or hurt the baby, she might require a medical help. And last but not the least, cesarean section, multiple cesarean section is harmful to both mother and the baby, because the afterbirth, what we call placenta, sometimes if you have a repeated surgeries, this placenta may grow into your scar tissue, it may invade your bladder, it may invade other parts of the body. We call that as placenta previa, placenta accreta and pacreta. So this is very dangerous. If you have having a repeated cesarean section, the probability of you losing your uterus, you having a lot of bleeding post your cesarean section, all those will be much more. So confine yourself to less cesarean section. So before deciding whether you have to go for a cesarean section or a normal delivery, you have to think over what is your condition, what is the health condition of the baby. You can decide and discuss everything with your healthcare provider before you decide on cesarean section. There are a lot of myths around the cesarean section, even though the cesarean section is a very most common surgery we are doing, but it's better to discuss with your healthcare provider before undergoing any surgery.